All right, listeners, it's Megan and Ryan, and welcome to the Mental Health Mixtape, a podcast dedicated to fostering open conversations, sharing stories, and exploring a diverse range of topics related to mental health. So, hold on to your seats as we sit down with some amazing guests to get their perspectives on the ever-changing landscape of mental health. For all you old folks like me, no need to hit the record and pause button. Just sit back and let us navigate life's playlist together. During this podcast, you may hear stories about traumatic events and our guests' experiences. There may be discussions about suicide, traumatic events, and the outcomes from these events on their personal lives. If you are struggling with anything you hear, please reach out to your peer support team, psychologist, call 911, or head to the nearest hospital. In Canada, you could call Boots on the Ground, peer support for first responders, at 1-833-677-2668. Talk Suicide Canada at 1-833-456-4566. And in the US, call 988 for the National Crisis and Suicide Lifeline. Disclaimer. The information shared on this podcast is for educational and informational purposes only and should not be considered a substitute for professional medical or psychological advice, diagnosis, or treatment.
So here we go.
What
the hell are we doing? Seriously, how did we get here?
I'm with you. I think in fashion that I'm starting to learn is kind of like you and I. We got together one morning, as we typically do, and said, hey, this is an interesting idea. Let's do it. Now here we are.
Kind of like the Ruck March. Hey, Megan.
Kind of like the Ruck March.
Hey, I got this idea. Why don't we do this?
Yeah.
And then now we're looking at doing other things.
Yeah. But to me, and I don't know what you would say about this, this is what I like about us. I really am sort of interested in, and I get really compelled by people who have ideas, but then like to turn ideas into action. And I've always had that impression of you. And so, today I think we're just going to chat, and I want to know about you, and we're going to ask each other some questions so we can introduce our listeners to just who the heck we are.
That's only if you have questions prepared, because I had questions and there's nothing there.
Okay.
It's blank.
Okay.
So we're just going to wing it.
We're just going to wing it.
Okay.
Well, I think that for any guest that we have, the thing that I am oftentimes thinking about is what made this person the way that they are. Mm-hmm. And that can be for good, for bad, or ugly, quite frankly. And, so you, right? You are somebody in the time that I've known you, which has been several years, I'm actually not ever even sure I've ever heard you say no. Which is probably problematic.
It's a boundary issue. I'm still working on that. My therapist at one point in time said I should probably work on that some more. But yeah, I think, I was just reflecting on our time that we've known each other. And the first time I met you, an enigmatic Dr. McElheran teaching PE therapy to a bunch of first responders from Dr. Ed Nafoe at UPenn. And I'm like, how did I get here?
Yeah.
Why am I given this opportunity?
Yeah.
And then that just started this interesting kind of landscape of mental health supports. I'd always been a part of that, but meeting you for the first time really kind of, for me, solidified that the work that I was doing with Alberta Health Services EMS was just where I needed to be and wanted to be.
Yeah, totally. I mean, I think we know each other well enough now to know that that's, I don't know. I just grimace at that description. But
enigmatic?
Yes. Barf.
But I mean, at that point in time, that was 2017. So that was just prior to the public health, the first grant offering for BOS.
Yeah.
You developed the program. It was kind of still being there, and you were really putting it out there.
Yeah.
You were in a lot of places, and your name was there. I mean, I watched your TED Talk in 2011.
Yeah.
No, don't cringe at that either.
I can't help it.
It was a good TED Talk.
Thank you.
But
I appreciate it.
That's the thing is when I walked into that space of training, I was nervous, and I don't know why.
Huh.
It was weird.
Well, yeah, I mean, you and I have known each other since then and have worked together to support, members typically of EMS, but I mean, we've certainly interfaced in other ways. And, I just I just think it's super cool that we're here.
Mm-hmm.
I love the conversations we have when we're out wrecking. I love how much fun it is to work with you and work with this team. And I think it's just really cool that we're going to do this and have people that we know and care about and are inspired by come and sit down with us and have these conversations, right? But I don't know. I just think, like, I'm with you. I'm not the greatest no-sayer either, and we can work on that together. But I just find that a really, I don't know, I find that a really special part of who you are. Like, I love people who are just like, I know sort of what the common good is. I know what the commitment to the bigger purpose is. And like, we just want to figure it out. And I think you have that in spades. And, and so I'm interested in how you got to be that way,
Oh, it wasn't all that. Oh, gosh. Now, but you want to go all the way back to when I was a kid? Yeah. Sure. No, I mean, I think for me, it was always trying to figure life out as I was a kid. I was very interested in the outdoors. I'd always been interested in the outdoors. And that was fostered through my parents and my dad and my mom. A lot of the things I did when I was 8, 9 years old was by myself out, going fishing at our cottage at the lake. So, I mean, I'd always had that interest in just being outside, and that kind of translated into some school where, my first foray into post-secondary education was at NAIT as a forest.
So you were like in kind of the Edmonton area around.
Yeah, I grew up in Sherwood Park, not Edmonton. Let's make a clear differentiation between the two of those.
Back up for our listeners in Sherwood Park.
Us Sherwood Parkians don't like being called Edmontonians.
Okay.
But yeah, we grew up in Sherwood Park, and I played football in high school, the quintessential education piece. And then I'm like, what's next? Like, I love the outdoors, so let's go do something silly like work and go do my NAIT forest technology.
Okay.
So I went there, worked for the Forest Service in BC and Alberta, fighting fires and wildfires till 1996, and then figured, well, it's a seasonal job. I can't really continue doing this. It was during the big government cutbacks during Ralph Klein's days.
Oh, yeah.
Not a lot of opportunity to create
Ralph Klein was
work.
a premier of the province for those listeners who may not have been around then.
Yeah, and back in the 90s, he cut so many programs.
Yeah.
But, that kind of caused me to come back home and reevaluate. And then, I started off in the Earl's kitchen and started to cook and like that. And then, you want to talk about a stressful place? I'd almost rather run a cardiac arrest as a paramedic than work in a kitchen.
Yeah, I could see that.
So high stress, I figured at 21 years old, it wasn't for me anymore. Wow. So then what?
Yeah.
So I went back to school again. Why not? Spend some more money. So I came down here to Calgary, found my love of the outdoors again, went through outdoor pursuits at Mount Royal College. And then I was like, now what? There's no full-time jobs guiding rafts. What the fuck? So I was having almost like an existential crisis at that point in time because I really didn't know. I didn't have a direction. The compass bearing was all over the place. Yeah. And then I was like, well, fire department. I volunteered on fire departments wherever I worked in Alberta. I'm like, well, why don't I just kind of look at Calgary Fire Department?
That's cool. Okay.
So in 98, I wrote my exam, but at the same time, I took my EMR program. So emergency medical responder, that first entry level into EMS.
Okay. And was that at SAIT?
No, that was at U of C's program.
Oh, cool.
Life Support International. Okay. So great program, really interested. I applied for fire, wasn't successful. Figured I'll just continue to work on my resume. Took my EMT, said, wow, this is really cool, I like that. Thankfully, I wasn't accepted in my interview. That's a whole other story for another podcast, but needless to say, I was late for my interview. Yeah, with Calgary Fire.
Huh.
Yeah, it was the quintessential spring snowstorm.
Oh,
and I lived up on Old Baptist Coach Road, so was late, so I didn't get that. And that was a great opportunity because it really caused me to reevaluate where I wanted to go.
Happy accident, maybe. Hey.
EMS was where it was. So then I entered into my advanced care paramedic, worked in IFT, which is our interfacility transport, for a while going to school. My wife was pregnant at the time.
I was going to say you mixed in a couple kids somewhere along the way.
Yeah, kid throwing, why not? Let's put it all into one basket. And then that was the start of my career. So in 99 is when I was actually kind of jumped both feet into EMS.
Okay. And you stayed with EMS until 2022?
2022, yeah. So almost 23 years.
Oh my goodness.
Yeah. And that's the best part of it.
Yeah. Yeah, totally. Well, I mean, you've certainly seen a lot of things and been around a lot of places, hey? I find it very funny that you were at Earl's when you were 21, because I myself was also working at Earl's when I was 21.
I was a day coach, assistant day coach in the kitchen.
No way.
Oh, yeah. I did all the positions, bar manager, waiter, host, expediter, all the fancy terms in the restaurant.
Oh, my goodness. So did I, actually. Yeah. That's hysterical. I feel like that should actually be like, on the resume or something.
No.
No.
No. I mean, I loved the work that I got to do at Earl's. It really kind of set in a work ethic that I didn't think many places offered.
Yeah.
To be honest with you.
Yeah.
It's high pressure. It's in the kitchen. You're producing food for people that come in, and there's a time frame, and it was really good for organizational skills, and I think it set me up to better understand who I was at the moment. Yeah. And I was on the fast track to get into a full leadership position. but the stress and the pay was just not happening.
Yeah, totally.
So
I actually say that to a lot of people, like being a waitress specifically, but I think specifically working at Earl's, like that's where I learned to be organized.
Well, it's like Brené Brown in her book. She talks about being in the weeds.
Yeah.
Or she's, what's the other phrase, when she just taps out.
Yeah.
I can't remember what it was, but I listened to it on a podcast, one of her podcasts, and she talked about that waiting. She's like, I'm in the weeds.
Yeah.
That means I need help.
Yes.
And then I can't remember her other phrase, but yeah, I can completely resonate with that experience, because you're like, got 6 tables, everybody wants something at some point in time, you got drinks on the go. And it really helped me prioritize and really learn how to work in a high pressure environment.
Totally.
Which kind of translated to EMS, really.
No doubt it did. It's funny, like even nowadays, this just happened like 2 or 3 weeks ago. I will have an Earl mare. If I'm feeling like generally disorganized or like out of control of my life, I will have an Earl mare. And I'm like, what is this?
I haven't had one of those, but maybe that'll come up now that we talked about it.
I know.
You start twitching at, when it's brunch time.
Exactly.
Because I worked the Sunday brunch.
Oh my goodness.
So we had the post-church rush.
Yep.
At 11 o'clock, open the doors, and then it was chaos.
Oh my goodness. Yeah. Or like I worked at the Earls, particularly on 16th Ave. So it was always like the post-Jubilee.
Oh yeah.
Whoever came in. Yeah. So like when did you get interested in, mental health and wellness and all that jazz? Because you've gone like a far way with all of that, with mindfulness and any number of other things.
Yeah, that started, I think, about 2005. We had a peer support team call out for, at that time, City of Calgary EMS.
Okay.
So I threw my name in, and it was a process, and it was an application, which I appreciate, and I was accepted to the peer support team as a peer support member. From there, it's just kind of been this constant support of peers within the team, being moved into a peer advisory as a senior peer supporter, taking extra training. I mean, the list of training I've taken, from ASSIST, which is the Applied Suicide Intervention and Skills Training, to anything I could really grab onto. And that was really where it kind of started, this idea that you could actually do a lot with this.
Mm-hmm.
And then I met my mentor, who I would call probably one of the most influential people, I can't speak today, people in my life. It started off with a lady by the name of Wendy Lund.
Yep. Okay.
So Wendy came to Calgary and for the peer support team did a mindfulness training. And it was, what is this magical voodoo BS? Because I always thought meditation mindfulness was this ethereal thing that you go sit in the mountains and cross-legged and chant Om. And although that is part of the practice, it's not the practice. It doesn't have to be. So Wendy kind of dipped my toe into it. And then I had the opportunity to meet Richard Gerling, who runs the Mindful Badge organization out of Oregon. He came up and did the First Responder Suicide Awareness Conference as a keynote speaker.
Okay.
And then the next day, the Calgary Police Association, John Gerloni, put on a micro-training with him.
Okay, I remember this. This was like, what, 2018 or something like that? Yeah. Okay.
And Tracy, my wife, Tracy and I went to this.
Okay.
I'm like, this is cool. Because the way Rich teaches it, and I think this is a really good kind of segue into a number of different podcasts, I believe, and we're going to have Rich on because I think he's just a badass.
Yeah, for sure.
Is he doesn't look at it from the lens of a true mindfulness teacher. He is a first responder. He is a lieutenant, retired. He worked for the Coast Guard. Like, he's just a badass.
Yeah, he's done a ton
and he's done
stuff.
Research in it, and mostly in the policing thing, but he gets it. He has the cultural competency on how to build a mindfulness practice from a first responder lens. Yeah. So that entered into all my training that I've done with Rich. And Rich and I have, developed a really good mental health relationship as far as mentoring and coaching. So I did end up taking one of his trainings. It's called the Resiliency Immersion Training. That was the first one. Then I went to a second one because I got stuck into it and I'm like, I need to know more. Then I had actually, just before COVID, signed up for his 10-week mindfulness-based peer coach for first responders. Cool. So through his organization, I'm certified in that. Right. And then I went back just this last March and worked with Rich down in, not Alton Collins, but in Oregon again, and co-taught with him. Yeah. That's where you sent pictures from, that beautiful spot. Yeah. So, I mean, that has been just one of the biggest foundational approaches to my own mental health, my own resiliency building. I don't like the word, but we'll use it as context. But I think that was really kind of this ebb and flow of understanding that we have more control, understanding how, if things do shift and change, how we can approach them in a different way. Because I still had the first responder glasses on, black and white, mad, sad, happy, all of the things. But then you start looking at some of the books I've read, from Dasher Keltner's Awe book, and you and I talked about that. Yep. there's just a landscape out there that is so powerful if you give the opportunity to really kind of embrace it.
Well, see, one thing about you that I really appreciate significantly, because I don't feel like I'm this way, quite frankly, is you just really seem to embody calm to me. Like, we can be in the midst of
you
something.
Talk to my wife about that.
Well, yeah, no. So like I guess that's my question for you is like, does that feel legitimate to what is happening for you on the inside? Because that is certainly how you feel to me when we're in the moment of trying to deal with a stressful thing or whatever.
Well, I think there's two ways I look at that. And that's a good question because, the way I was trained as a paramedic is to walk into any situation to try and create some calm from the chaos that somebody's experiencing from their medical emergency. What I didn't know for years and years and years, and had impacts on my personal life, is that don't know how to reconnect. We can shut down, but we just don't know how to reconnect. We can talk about BOS later, but that whole reconnection piece. So I was left really struggling with the internal environment and the narratives that started to pop up. So calm on the outside, chaos on the inside.
Right.
With the practice and the changes and the shifts that I've been able to learn and actually experience is you don't have to have the chaos. And if it is there, it's data.
Right.
This is the interesting shift that I've noticed in myself is that it's only information, it's data points.
Yeah.
And it doesn't necessarily need to predict your future.
Yeah.
So again, going back to the mindfulness practice, that's where that is so powerful for me. Where I can recognize now, feeling some tension in my chest. What's the anxiety? Because that's where my anxiety sits. What is it? Look at the data. Don't kind of get into that future thinking, past worry kind of thing. Okay, what can I control? What can I not? What can I do in this moment? Take a breath. Okay, good. Take another one. So it's this landscape and this shift that I've learned to do. It's still moments of chaos, the hair on fire, if you want to call it that way. But I think I'm more apt now to at least name what I'm experiencing, work through it from a data perspective that it's only information. And then what do I control?
Yeah.
I control how I show up.
Yeah. Well, and I think, from what I understand from you, you also practice this. Like, you practice it every day.
Every day.
Yeah.
I have to.
Yeah.
And I think that's the skills progression, right? We talk about skills within EMS or training with fire departments, police agencies. We talk about the hard and soft skill sets. And I would really like to take that lexicon and shift it.
Me too. Yeah.
Soft skill sets are not talking to somebody.
Yeah.
That is a hard skill set.
Right.
But it's trainable.
Right.
That's the awesome piece.
Yeah.
And that's what I had to do. And if you don't train in it, you lose proficiency.
Yeah.
So my practice every day is the same because I know it's actually helping, and it's actually helping me move through spaces that I before probably wouldn't have moved through.
Yeah. I find that really fascinating. And I appreciate that you practice things as much as you do. Like, I think sometimes that's where I can fall short. But I think, my experience, and I think it would mirror the experience of many others who work with you, is just like there's a trustworthiness or a reliability, or like there's a comfort in being in your presence, whatever is going on. I think because, you put these things into action and, you're exceptionally knowledgeable, which is really appreciated.
Well, I think what I don't want the listeners to think about is that it's all sunshine and roses every single day.
Yeah.
It is not.
No.
Whether it's working through a space or a difficult space with my family or a loss of my dad last year, almost a year ago now, there's stuff that just falls on your plate and there's no way to work through it in that moment.
Yeah.
But what I learned is how to accept it.
Right.
As just a moment in time.
Yeah.
So do I fail? I don't like the word, but do I fail in being mindful all the time? Sure, absolutely. And that's a normal human experience. We're all going to go through that. But I think what I do look at now is I'm far less judgmental when I get stuck.
Right.
I'm more willing to kind of engage and open up and talk about it.
Yeah.
Still a work in progress, but we're getting there.
For sure. So do you feel like, given that that's kind of the approach you're taking, like, do you feel, I guess the way I would put it is like that you're in the best mental health of your life kind of thing? Or
I think given the span of my career, I would say I'm probably the most healthy I've been in 23 years of being a paramedic.
Wow.
If I would have known some of these skill sets on the front end, not to say that the experiences would shift and change, but I think the willingness to actually lean into the space of what am I experiencing in the moment without judgment, because I judge my clinical practice.
Yeah.
Did I do enough?
Yeah.
That person passed away. I did everything I could, but why did they pass away? Like, we're trained that way. We're trained that way from the school standpoint so that we can really, or at least I did, and I've heard it from a couple people, is that even though we do every single thing correctly within whatever protocol, whether you're a police officer, firefighter, military, I mean, this I think is a common theme. Outcomes are going to be negative at times.
Yeah.
So how do you wrestle with that?
Yeah.
I'm more apt now to look at it for what it is.
Yeah.
And experience what I need to experience. If there's grief, if there's loss, if there's sadness, I mean, it's all of the 82 emotional, descriptions.
Mm-hmm. Yeah. And I think that's the piece, right? Like, are you just willing to have what you have, and yeah, I mean, that's something that I certainly still work on, right? Like even just the ability to be willing to acknowledge that it's there.
Well, and you get stuck. I mean, everybody gets stuck at times, and that's okay.
Yeah.
But you also have to cultivate this idea that there's other people around you that care about you. And when you isolate, they're kind of left going, oh, what the is going on with him today?
Yeah.
And I'm sure at times over the span of our married life of 23 years now, don't kill me if I'm wrong, 2001, so 22.
Yes, 22, depending on when you got married.
Yeah. I failed at that.
Yeah, sure.
Right.
Well, that's marriage, though. I mean, that's relationships.
And that's a relationship with yourself as well.
1,000%.
Right.
Yeah.
So I tended to isolate. I'm good. I'm fine. Well, you know what those two things mean.
You've said it to me before.
Good is never good. Fine is never fine, because fine means you're fucked up, insecure, neurotic, and emotional.
There we go. And what's good?
Good is never good.
Good is never good. Okay. Yeah. Yeah.
Because I mean, realistically, that's what our expectations from society are. Or at least that's my experience.
Totally.
How are you doing, Megan?
Yeah, I'm fine.
Yeah, no, you're not.
Yeah. Right. Totally.
See where that causes me to lean in more and go, tell me what fine is.
Yeah. Yeah. Yeah.
Never before would I do that, because I use those same words.
I know. Well, it's a social convention, right? And I mean, I think in our world where we are trying to have different kinds of conversations, we're more willing to sort of go, are you really fine? Or what does that mean? Right. Whereas, what I hear a lot from people is that they don't know how to help or support people who are struggling. Right. And so like they only want to hear that you're fine because they don't know what to do necessarily if there's like something subsequent to that. Right.
Yeah. What if somebody says something to me and I'm left going, what do I do?
Right.
Well, and that's a space you can train in as well.
Totally.
See, and this is the thing that I learned, is that all these skills are trainable.
Yeah.
We just need to be courageously authentic. And that's one of Rich's phrase, courageously authentic, to lean into that space of training, because what it causes you to do is self-reflect.
Yeah, totally.
Where am I at?
Totally.
What do I need to work on?
Yeah.
Because you can't offer peer support or support for yourself from a non-compassionate lens.
And I don't know if this is true or not. I just went through a little bit of a blip myself, as you know. And one of the things I was thinking about is like, I ultimately kind of got to a place, before I decided to take some time away, of feeling like really kind of feeling like people in my life didn't care. They just kept wanting more and more and more and more from me. Right. But what I actually came to really conclude was that like, that was actually just a reflection of the fact that I wasn't taking care of myself. Yeah. Right. And so it's so easy to put that outwards when in fact it's the relationship with yourself. Right.
Yeah. And Kristen Neff's work on self-compassion.
Yeah.
Amazing.
Totally.
Love that work.
Yeah.
It causes a lot of stuff to happen. Because you have to actually look at yourself. Because I looked at it, and maybe this was something that Rich offered, is to be compassionate to others, you have to be compassionate to yourself first. And I think that is not something that's normal within the first response role. We're outwardly compassionate. We're being paid to be compassionate. So we set our needs aside, but yet we need to figure out that other landscape of how do we reconnect to our own compassion. And that's self-care.
Totally.
And what is self-care? Well, I don't know, whatever the fuck it means to you.
Yeah.
Really, because it's different for everybody, but we can figure that out. You can train in it.
Yeah.
You can try this or try that, emotional journaling. You can try meditation. It's for some people, and some people, they don't understand it.
No, and I think, I've always kind of marched from the perspective of we're going to do to other people what we're doing to ourselves. And that can be for good, for bad, or neutral, right? Yep. And so, I think that's the thing. It's hard to do, right? But it's like if there's something that's happening in your life that's maybe not going super well, I think the discipline that we can all have is to go, how am I creating this, right? Or how am I contributing to this at a minimum, right?
Yeah, and Rich brings up a really interesting perspective that there's four components to what, I can't remember what he defined it. It was your physical health, so see a doctor on a regular basis, your spiritual, whatever that means. And it doesn't mean constrained religion. It can be just a sense of purpose, a sense of tribe, right? Having people that aren't necessarily part of your peer group in work, but cultivating a sense of tribe, of really kind of having this idea that you are a collective.
Yeah.
Right. And the last one is having a psychologist.
Yeah. Yeah.
Like, I think, yeah. like having somebody like yourself or the team here at Wayfound, or it doesn't matter, but having a psychologist, so that when you are struggling, and if you built that awareness, you're more inclined to go and get that help sooner before it becomes a wound that needs to be debrided and cleaned out. And
totally.
And that's a long process.
Yeah. And there's value, right? There's value in having somebody who's objective and not actually part of the like day-to-day workings of your life, right? Mm-hmm. Yeah, for sure.
That's my landscape. I mean, it's been an interesting ride. At times I felt like I was just holding on to see what life offered and wasn't really participating. But now I think what I see is that there is so much more that we can do individually if we're just courageously authentic. Really just kind of lean into that space. Yeah. If you don't know, ask. If you don't, or train, or get the information, read a book.
Yeah, right.
Like, gosh, I read so many books, it's not even funny.
Yeah. And read them critically, right? Yep. Like, I mean, I think also it's like there's so much out there.
There is.
For review. And I think that can sometimes be a bit overwhelming. But like, read things and, figure out what fits for you, right? Because what your tapestry looks like isn't going to be mine, right?
No, and that's the biggest thing that I can say is everybody's journey is different.
Yeah.
And there's some common themes that inject themselves across the span of that training.
Yep.
But I think that if we're just open to the possibilities of doing something different, based upon just simple data, and that's data from the internal environment, we can really move to a different space. I mean, I'm more inclined to talk to Tracy about how I'm feeling. Still hard, still kind of pattern behavior. I get that, but I can recognize it now. Right. And there's an open conversation. So I would encourage any first responder, anybody really, that, take the opportunity to really kind of just read, get some training, work this stuff out, go and do it.
I think even, and I find this very difficult, but like even just develop the capacity to sit still.
Oh, God.
Even if it's just for like 2 minutes or 5 minutes, like it's remarkable to me how difficult that can be.
But it's a mindfulness practice.
It is.
But here's the great thing about mindfulness. You can make a cup of coffee and be mindful doing it.
Yeah, that's right.
And it's those micro moments that actually bring us back to that present moment that allows us to check in with ourselves. And that's the power of mindfulness. I never bought into it.
Yeah.
And I thought it was bullshit.
Yeah.
Until Rich actually layered in the understanding.
Yeah.
That really what we're looking at is how do we shift from the future thinking, the past worry, and be here in the moment with the data, be curious, non-judgmental, imply some compassion.
Well, and I think that's so important, right? Because I mean, that sort of is a relatively, simplistic way of looking at things, that like anxiety is being derived from, future forecasting and the things that you worry are going to happen. And depression comes from ruing over the things that have already occurred, right? And so really maybe where we can find some freedom is in just being present to whatever the moment is that we're in,
Yep.
But you have to sit still enough for that. And I think also we don't always like what we find,
No.
And so willingness and acceptance doesn't actually have to feel like wanting. It doesn't have to feel good, right? It's just, again, it's just being,
Yeah, it's data.
Yeah.
What is this data telling me in this moment?
Yeah.
Not 5 minutes from now.
Yeah.
Not 5 minutes ago, but in this moment.
Yeah.
And then work through the piece. Like one of my favorite practices, and I can't remember who did it, and I know you will reference it, is the RAIN practice.
Michelle McDonald.
Yeah. It's a powerful practice.
It really is.
That's the sitting still, recognize, accept, investigate, and normalize.
Yeah.
It's the hardest practice you're going to do.
Yeah. And, I've been tacking on for myself in the last few months a notion of surrendering, and to me, I've been really trying to, within myself, work along the continuum of like, fears on one end, perhaps faith is on the other, and sometimes it's surrendering. I agree with the spiritual practice of whatever that looks like for you. I have a sort of spiritual set of beliefs, and it really is like the faith to let go, that I have to recognize that I actually can't be in control of all the things I think I need to be in control of. And B, the attempt to do that is just robbing me of happiness or contentment or peace, or whatever word you want to use.
Great podcast that I'm listening to called The Dharma of Work. And how to work through those difficult spaces. And that acceptance is what you're saying of the moment and letting go and surrendering. Because there is a different plan at place. From what I found for me, is holding on is more out of ego.
Yes, totally.
So if we learn to suppress the ego, or at least recognize it when ego rises, I'm more apt to surrender and through acceptance, figure out and let the world figure it out for me.
Yeah. Yeah. Well, and like thinking about how we come to be here with this podcast and all the people we're going to talk to and whatever. I mean, we've kind of lined up at least our first number of guests, and I suspect there's going to be like variations on a theme. I suspect the folks that we're going to talk to will probably, share certainly their own journeys and ways that they've suffered or things have been hard. And I think from what I know of them, this is some variation of this is what they're going to talk about.
Yeah. Surrendering, ego, vulnerability.
Yeah.
Because we're talking really about public safety personnel, military, healthcare workers, where really it's normalized to just put your boots on, go to work, get the next call done. Don't worry about everything.
Well, and you have to be seen to be
in control
and tough and smart and on top of your game, and like all of these sort of narratives that, like, I don't have anything wrong with them, quite frankly. I mean, who doesn't want to present as put together and having some things figured out and confident, whatever, but it's when it's a facade, right?
Yeah.
Or when there's no balancing act to the other side of things, right?
Well, Rich brings that up in his trainings. He talks about mindfulness is actually about increasing your human performance. So from a policing,
stoicism, right?
Right, and it's Stoic philosophy. I mean, my favorite Stoic quote, it's on my phone. What is it? By Seneca the Younger. What is it again? Oh yeah, wherever there are human beings, there's an opportunity for kindness.
Yeah.
So I mean, now apply that to a paramedic, to a police officer, fire, whomever that might be. That's a human performance piece.
Yep.
We have an opportunity to lean into compassion and empathy and kindness. Still have a command presence.
Still be
if
a
you're
warrior.
A police officer and be a warrior, but yet we can be that kind warrior that knows boundaries.
Yeah.
And that actually, if you can do that, you can exude that and people will feel it.
Yeah.
And it's weird. It's weird.
Well, I mean, I can go really far down a rabbit hole sometimes in my own mind, which I do often. But like, I think there's some things that we talk about, and I think, they've got their contemporary interpretations. And I actually think this is what Carl Jung was talking about with the collective unconscious and the archetypes and stuff like that. Because, as you know, I'm really interested in, I know as are you, in Stoic philosophy, and sort of, I really like history, and I find things really interesting from ancient civilizations, because I think they've just repeated in many ways across the course of human civilization. And here we are at, in 2023 with our own versions. But just on that point, did you ever see Schindler's List?
Yes.
Okay. So there's this great scene in Schindler's List where Schindler is talking to, what's his name? Ray Fiennes. I can't remember.
The commander.
The commander, yeah. And they're talking about compassion and kindness and where does power come from. And Schindler is essentially trying to convince Goethe, Goethe, that actually, instead of punishing people who he could punish, he demonstrates greater power by extending kindness and not, distributing punishment, etc. And so you see Goethe, however you say it, struggle with that the next day with the kid who was shining his first his tub and then his riding saddle or whatever. And I just think that's so interesting, right? Like this notion that somehow we lose toughness or discipline or whatever if we extend kindness.
It's power.
It's power.
It's powerful for you.
Yeah.
And I think that's the interesting, misappropriation, whatever word you want to use, is maybe it's just been flipped on its head from years of just history. But I firmly believe that kindness is power.
Yeah.
Kindness is personal power, not power over someone. Let me be clear about that. But being kind to somebody opens up possibilities for compassion and empathy. Yeah. And trust me, I didn't think about this stuff 15 years ago.
Yeah. Well, this is the benefit of wisdom and maturity, right?
Well, it's a power dynamic. Anytime as a first responder you walk in the room, there's automatically going to be a power dynamic.
Yeah.
Right? And that is something that we could potentially dispel or at least mitigate in some way, shape, or form if we just understand some of the concepts around kindness and compassion. Because realistically, if you're an injured medic, or if you've got an injury, an OSI, occupational stress injury, I don't know if you can tap into that. I know I didn't. I was just grinding it out, going from one call to one call, and I wasn't very compassionate at times.
Well, I mean, I think it's that thing again, right? Like if you're not helping yourself, if you're not healing yourself, if you're not tending to your own wounds, whether they're, physical or psychic, how then can you possibly give that to other people?
You can't.
And like Gabor Mate talks about this in the addiction world, and I just love it. And it's very, I mean, it's obviously he's a psychiatrist. It's very consistent with how I was trained, which is you have to find the point of empathy, right? And that is oftentimes the hardest to do with the people who are the most prickly, who are the most aggressive, who are seemingly destroying their lives, right? People struggling with addiction, whatever it might be. You know, you have to, the discipline, the kindness discipline is to say, what happened to this person? What's happening beneath the surface? Like find the point of empathy instead of what the other perspective is, which is what's wrong with this person? Why are they like that? You know?
It's funny you bring that up because that was a pivotal part in my perspective on the street. And it wasn't until one of our clientele downtown, one of our homeless person, we picked them up for a medical emergency, and really, I don't know what happened or why, but I heard their story. And their story really resonated with me for probably a couple months. I'm like, we have an opportunity to understand if we choose to ask the questions. And that is empathy. Because really, I didn't know, like I didn't understand, like, why would you choose this life?
Right.
Until you get to the root.
Right.
And they say, well, would you want to live in a place where you're abused?
Right.
Would you want to live in a place where cigarettes are put out on your back?
Right.
I choose this because it's better than the other place I was in.
Yeah, right.
And you're like, okay, wow.
Yeah.
Thank you for sharing, but
yeah.
Okay, I got to reevaluate something.
Yeah.
So that was a big shift in me, in my perspective. And I think that was probably one of the more pivotal parts in my career when I actually took that opportunity to understand a little bit and have a door open for me.
Yeah, totally. I mean, in my work as a psychologist, you know, and it's, you know, there's different schools of thought and interventions, whatever I will draw on. But I mean, a general guiding principle always is like, find the point of pain for this person, you know, because if you can go there, it doesn't matter how many times you have to go there, but if you can find that point for them, right, there's probably going to be something that's going to happen by way of this person feeling validated or maybe a need finally being met that has gone unmet for so long or whatever.
Finally being heard.
Finally being heard. Yeah. You know, and I don't know. I mean, I think these are just such timely and important conversations at this moment in our history. You know, I don't have enough knowledge to say if nowadays things are worse than as bad as they've ever been. Probably not.
I don't have a time machine.
Yeah, right. And it's relative or whatever, but you know, we have to hold on to those beautiful exceptions, I think, of times where we see kindness being extended. You know, because there's so much trauma and there's so much pain in the world, you know, and I think if we only ever look at things through a lens of, you know, why did that person treat me like this? Or, you know, from a place of anger, then we're just always going to be missing one another.
Yeah, we missed the mark.
Yeah.
Multiple times.
Yeah.
All right, so enough with my therapy session.
I'll send you a bill.
Yeah, no kidding. I can't pay it. You can just take it out of my wages. No, so, you know, going into this podcast, you know, I appreciate the fact that you had some questions ready. And to be honest with you, I had a couple of questions, but I think what I want to, and we're going to go back in time a bit to how you got to where you are, because I think that's an important piece, right? In your TED Talk, you talked about in around 2006, you started working with teens and sexual.
Earlier than that, but yeah.
Yeah, so I mean, I know that WGM, the original way found, and your dad and mom were both psychologists, correct?
My dad's a psychologist, still is. 85 years old. It's time to hang up the shingle, Dad. My mom she's a marriage and family therapist. She started her career as a nurse and, but ultimately got into mental health, and they met each other in Toronto. I think at the Toronto Psychiatric Institute or something like that as professionals, not patients. But,
glad you clarified that.
Listen, growing up could have been either. Yeah. So, I mean, I just grew up really exposed to issues related to mental health and, really actually tried to rebel against that in not even conscious rebellion, just like tried to explore something different. Actually studied hotel and restaurant management for a period of time.
I was going to say, was this always kind of the pathway that you wanted to take?
No, I mean, I think I probably unconsciously pushed away from it for a long time. And then, ultimately back to that theme of surrender, just got to a place of going, this is what I'm best at, I guess, or this is what feels right. Or when I was in university, it was the thing that interested me the most and I did the best at. So I just sort of went, okay, well, let's just follow this and see where it goes. And that's what I've been doing since 1995 and, happened to be here.
So link your experience with, because Stanford grad,
Yep.
Link your experience with the VA. So you went from Stanford, and part of your training was with the VA in school.
Yep.
And then you worked in California.
Yeah. So I lived in California. So I did my bachelor's degree here in Calgary, and then I worked here, and that's where I worked with that program with adolescents who have been involved in the sex trade, right? Okay. So that was really pivotal, as I speak about in my TED Talk, and if anyone's ever listened to me ramble on about these things, you've heard that story. But I really loved that work, and that was where I actually got really interested in post-traumatic growth. And trauma, right? Like I was really interested because of what I was seeing with this population of very young women, girls really. I got really interested in how can people be so poorly treated and traumatized and abused and whatever, and yet still be inclined towards growth, right? And that work in post-traumatic growth was really in its infancy at that point in time. So anyways, it's I tried to get into grad school for 3 years, I think it was, and I just kept getting turned down by Canadian programs. And then I just on a whim and a prayer sort of threw in this application to this very new program that Stanford was putting together with, it was called the Pacific Graduate School of Psychology. It's now called Palo Alto University, but they were putting together this consortium program that had this roster of these incredible professionals who were going to teach all these things, like David Burns and Irv Yalom. And so I was like, okay, I'm in, why not?
Why not?
And hadn't heard back from them. And I was at a point where I was like, okay, well, psychology is obviously not going to work out. So I was starting to look at, should I go back to become a nurse? Should I do the 2-year program at U of C? And then I got a call from the admissions department at the consortium going, we've been trying to get a hold of you. Or no, actually, you know what? I called them because I was like, they hadn't sent me a rejection letter or anything. And I was kind of pissed about it. I was like, the least you could do is reject me.
Yeah.
And so I had actually called them, and they're like, oh no, we've been trying to reach you and we didn't have your contact number. Can you be here in 2 days? And I was like, okay, let's go.
Packing up the car.
Yeah. So down to Palo Alto, I flew and interviewed, and then they made me an offer, I think that Monday, and I accepted, and 3 weeks later moved to California. So yeah, I mean, so the pathway there is that I just wanted to really pursue learning about trauma and learning about how people recover from that. And so there really wasn't a training opportunity other than in the Veterans Affairs system. And so I think from my first year was just really coursework. I think we started practicum training the second year, something like that.
Because that was between Desert Storm and Afghanistan conflict, Iraq, correct? So you were working with post Desert Storm.
Post Desert Storm, Iraq and Afghanistan, OIF, OEF. So Operation Iraqi Freedom, Operation Enduring Freedom were still going on. Okay. Yeah, because I started school in 2003.
Okay.
Something like that.
So post 9/11.
Yeah, post 9/11, right post 9/11. Yeah. And that was really, oh my God, that was fascinating. So in Menlo Park, that VA campus there is huge. We just we don't have anything equivalent. So this took up half of Menlo Park, and it had multiple different buildings, and a couple of them, there was a men's residential program and a women's residential program. And so I worked in the women's residential program, where female soldiers were coming, and they were either active duty or veterans, and they were coming for long-term care of post-traumatic stress disorder. And usually for them, it was military sexual trauma. And so, yeah, I just rinsed and repeated as much as I possibly could. I just stayed involved in that because I really fell in love with the personality makeup of uniformed service personnel, I guess. I just loved it. And it gave me incredible training in terms of how do you work with people whose nervous systems are really injured and disrupted, and what are the powerful mechanisms that help people to recover their wellness. And so I did individual therapy, I did group therapy.
So is that where you started to build that cultural competency towards, especially the military piece? Did you work with public safety? Did you work with anybody else?
No, it was all military at
military?
That point in time, yeah.
So how did you get to the point where you wanted to work with the first responder population? Was it a natural, just a kind of natural shift when you came back to Canada?
Yeah, so I mean, I came back to Canada. I was either going to go to New Orleans or Ottawa or back to Calgary for internship. And I ended up coming back to Calgary, and I feel like I was really fortunate because I came back to Calgary in June, and I was supposed to have the summer off to finish my dissertation. And I actually ended up having some pretty serious health problems, and I was just really lucky to be back in Canada and have provincial health care and whatever. So that's basically what I did with my summer. Did my internship here, and then when my internship was finishing up, Calgary had opened up an operational stress injury clinic, and so they just happened to have a job opening. that they originally weren't going to take me for because I was provisionally registered at the time, but then they ultimately did. So I went and worked there for like, I can't remember, 2 or 3 years, something like that, maybe 2 years. And that's all for Canadian military, active duty veterans and RCMP.
Yep.
So that kind of bridged that American to Canadian experience.
Is that the OSI
That's the OSI. No, just OSI.
Okay.
So OSI Canada is something separate. So this is the operational stress injury clinics, and there's a network across the country. So like Edmonton has one, Vancouver has one, Ottawa has one. So there's a number of them. And then I was doing that, and my dad, as you mentioned, like he had WGM psychology because his initials are WGM, right? William Gordon McElheran.
I finally figured that out.
Did you? Okay.
Yeah, not too long ago, actually.
Yeah, there you go.
Well, you know.
So I was working at the OSI clinic, and I decided I was going to start to do some private practice because I was getting, the odd question, would you see my son? Would you do this? Would you do that? So I was like, okay. So I started like a couple nights a week doing that. And really what happened, I think, was that at the time, there just weren't a ton of psychologists or practitioners working with uniformed service personnel. And within the OSI clinics, you couldn't get services unless you were a Canadian Forces veteran,
right,
or RCMP or soldier or whatever. So when I put my shingle out saying I'm doing some casual private practice work, like very, very quickly, I met some folks within the Calgary Fire Department, paramedics, and it was just like a fuse that kind of got lit.
And off it went.
So I got busier and busier. So I ultimately went down to 4 days at the OSI clinic and had a full day of private practice on Fridays, and was getting busier and busier. And in 2010 or 11, something like that, I was just like, okay, well, what the hell? Let's give this a go and see what happens. And so I quit the OSI clinic. The naivete and courage you have in your youth, right? And just like went full time into private practice and had about, I don't know, maybe a month or so that was really kind of scary, and then just got so busy and have not stopped since.
So how did you get associated with the University of Pennsylvania, Dr. Edna Foa's program?
Yeah, okay, so
because that's an interesting trajectory that you went through to get to where you are now, obviously.
Yeah.
But when I took my PE therapy clinician training, that was the first responder group that was offered that training from Dr. Foa.
Yeah.
So how is that linked in there?
So I got trained to be a provider of prolonged exposure by Dr. Foa and her group. I went to Ottawa and got trained. And then when I was at the OSI clinic, they wanted to have some of their clinicians get trained to supervise others so that they could have that in-house like knowledge translation. So the OSI clinic supported me to do that, which meant that I participated with a group of clinicians from that OSI network. And we went through a year, I think, of training. We had to have a couple of cases supervised and And so then we became certified as supervisors.
Yep.
And then after I left the OSI clinic I think it was like in 2015 or 16 or something like that, Dr. Foa was then going to do a training for trainers. And so myself and David Paul, who's in Edmonton, and a couple of others, I think, went down to Pennsylvania again, spent like another full week and learned to train clinicians in PE. So that, and I had met Glenn Close in Edmonton around that period of time because he had actually been taking PE with Elna Yad in it. And I had sort of been a ride along on her program. I'd met Glenn, and Glenn was, as you know, putting together reintegration, and it really fit for him, the PE training. And so then he and I connected, and he's like, what if we tried to do this? And
next thing you know, away we go. And now I have a certificate sitting there from UPenn.
Yes, you do. Yes,
That's
you
awesome.
do. Yeah.
Wow, it's quite a trajectory. And it seems like it's been fast-paced. As it's slowing down at all. Okay.
No.
But I mean, we talked at length, when you asked me a couple questions, and I guess the question is, has at any point in your career as a psychologist, and I've been curious about this, have you actually ever looked at, or has anybody presented training within your schooling about self-care, self-compassion, those pieces about how do you take care of yourself given what you do? Because from my understanding, you've got psychologists that treat psychologists.
Yeah, for sure.
Right? So there's is that landscape normalized? Like, do you have the mental health conversations about how the work will impact you? Because I'm curious, from a first responder, we don't get anything. We get maybe a 30-minute presentation on critical incident stress management.
Yeah. I would say way more, and like if I think about, I think there's lots of things that influenced the curriculum of BOS, that I developed. But one of them was, I did, what did I do? 12 years postgraduate, so after high school, I did 12 years of schooling, and 6 of that at least had a really heavy focus on supervision and consultation and peer supervision, whatever. And that was really from the perspective of understand how you are being impacted, understand how to work some of those things through, like whether that's issues of transference or countertransference or burnout or whatever. And there is absolutely a focus on, doing the work I do, which is working with people who have experienced trauma and There's lots of talk about how do you sort of manage that. So I would say, I still don't know that I think it's enough, because I look at some of what we teach in BOS and I go, man, I feel very vulnerable to some of those cultural factors too, right? The notion of, presenting as though you've got it all together, like this enigmatic Dr. Megan McElheran bullshit, right? Like, I mean, to me that fuels a bit of that narrative, right? Yeah. Like, and somehow I'm different from just being a regular human being, right?
Hey, for our listeners, if in case you don't know, BOS stands for Before Operational Stress Program.
Thank you for that.
It's a foundational mental health literacy program that's offered by Wayfound and the BOS program. So, I mean, no, and that kind of goes right into the next question is, for most of our listeners that don't know what the Before Operational Stress Program is, this started really from you understanding that there's a need.
Yep,
right?
Totally.
It's like the movie Robots, one of my favorites, Big Weld. It says, see a need, fill a need.
Yeah.
And from, knowing the story about how BOS's genesis started to occur, where do you think we're at now? Are we getting better providing mental health across the nation?
Without question, we're getting better.
What's missing?
Time. I think I can't believe how much has changed and how quickly. If I think about even like 2011, 2012, when I kind of first was full-time into this to now, there's been an exceptional amount of change. And actually the change that has occurred has maybe gone too quick, in the sense of it takes people a step to have, their own personal attitudes and perspectives catch up. But then if you're talking about organizational attitudes catching up. So I say time because I think sometimes when we look at cultural change, that's a necessary ingredient, right? You need opportunities for new ideas and attitudes to be socialized, right? So, I remember there was a really distinct moment 4 or 5 years ago where there had been all this, like, if you were getting called out by police or fire or whatever to come give a talk, like if I was asked, it was always on, like, come talk about PTSD. What is it? How do we recognize it? And there was like almost this demarcation point where it was like, we've got that. We understand this is a problem. We now want to know more about what to do about it, right? What? Yeah, the now what factor. And I thought that was actually really kind of cool. And that, that is where we talk about upstream interventions, the importance of peer support, having a pathway to care if somebody needs it, system navigation with WCB, that there's reintegration and informed supports about how to help people come back to work, that there's, a whole organizational interventions to help people understand what's going on. Like, that becomes the now what. But there had to be a period of time working on people really understanding and acknowledging and recognizing that this is a problem.
Yeah, when I first started, there was very little taught in school. And even now, I would say it's minimal at best.
For sure. I mean, I was directly told when I first started talking about the notion of upstream training that, like, we don't want to tell people coming into these careers that they might experience trauma or stress, because then they won't join the career. So it's almost like we're going to deliberately obfuscate the picture so that, people will still come and do these jobs.
Yeah, the landscape has definitely changed. And even in the peer support world, from my perspective, in 2005, when I started in peer support, there was a big shift into, using one model that didn't fit, and that model, we can discuss that in another podcast, but it didn't land with me. And it was more about the individual supports.
Yeah.
And then all of a sudden, this narrative started to kind of slowly percolate through, the profession about, you don't have to just pull your socks up. There's something different we can do. And this has slowly been building, but you're right. I think the pendulum has swung so far now that nobody wants to monetize mental health. But I think, organizations, if they're complicit in not understanding what the role is that these new staff are going into, we need to do a better job. Like, we literally need to help people kind of not make this a job, but make it a career. Because I look at 23 years and there's people on the street now that are out after 8 to 10. And then what?
Yeah, totally. And I mean, if I think back to, like, so I had been on my own essentially working for like 3 or 4 years or something and being so busy. And, it was really, like, it's really sad. I find it very sad. I have always found it kind of heartbreaking to be with people who, you know, like have been really significantly injured by the things that they've done in their jobs. And you know, it just happens that the people I work with, their job is like to protect me and to protect my family and our nation and things like that. And sitting with somebody who has to wrestle with and come to terms with, like, you may not be able to do this job again. You may be feeling an extreme amount of betrayal from this organization you've committed yourself to. You may be looking down a future that has, you know, doesn't have a relationship with your spouse or your children in the same way or whatever. Like, that's heartbreaking to me. That's a really, really heartbreaking place. And, you know, for a while there, that was like most of my day in, day out, rinse and repeat. And as you've heard me say before, like, I just was like, this is bullshit. Like, and just like, I can't keep hearing this. Like, this is just, it is so shameful. The only word I can come up with.
Yeah. Wow. So where are we at now? What do you want to talk about? Are we done? You want to go on to the next things?
I mean, I think my final question to you is, like, what do you hope people get out of our podcast?
You know, I think the podcast, you know, when we came up with this crazy idea and decided to run down the road of podcasts, because there's so many people in podcast landscape, I think, you know, for me, it's just having authentic conversations about experiences and seeing what's on the other side. Yeah. You know, I think there's a lot of fear from first responders about, well, what if I'm injured? What if I raise my hand? What if, you know, my employer doesn't support it? What if? And I think the conversations that we're going to enter into really, my hope is that gets people to see that, you know, there's a different way, you know, that's supportive, that can actually help build your resiliency, give you some literacy, give you some foundational approach to mental health, how to actually have that human performance factor increase within your work and your role. Because really it's about, for me, it's about not having that fellow paramedic or police officer or firefighter get to the point where they actually can't go back to work. Give you the tools to say, hey, wait a minute, in this moment right now, I'm suffering. Because there's one of my favorite equations in mental health, or that I've kind of bastardized from the Arrow of the Sutra, it's a Buddhist story, is that, you know, it's an equation, P times R equals S. So it's pain is the constant, emotional, psychological, physical pain. R is the resistance. So when we add the pain and we multiply it by the resistance that we from ourselves have towards that, we suffer. But if we can reflect on our experience, we open the opportunities to grow. And I think for me, that's a powerful statement when I look at the reintegration process and what I did, that was what it was opening, is the opportunity to reflect on your experience as data with no judgment and curiosity, so you can decrease your suffering and increase your growth.
I love it.
And that's my goal. I mean, we're going to have lots of different people with different perspectives. My hope is to kind of really broaden the landscape of what our discussions are.
Yeah, totally.
How about you?
You know, I talk a lot, especially when I'm talking to leaders of organizations, and I talk about this notion of we all need to implicate ourselves as both part of the problem and part of the solution. That's simplistic language, but just for the ease of understanding. And that's what this is about for me a little bit, right? Like, I want to bring, I want to sort of be part of a conversation in a different kind of a way, from that place of authenticity, you know, like, I think it's really incumbent on a lot of people who are maybe seen as leaders or who hold leadership positions to, like, you know, actually be willing to be vulnerable, and that actually can really be an important contributor to how things can continue to change, you know? So there's that. Plus, you know, you asked me about sort of self-care. We mentioned that. This is that for me, you know, like, literally, if, you know, my mom and Tracy are listening, you know, and that's our audience.
No, you never know.
You never know. I mean, the ability to sit down once a week with you and just, like, talk, you know, with whoever's going to join us and, like, have these conversations. I think, you know, this is how I stay motivated and stay connected and hopefully continue to hone my craft. Right. So.
Wow. All right, listeners. Well, we're going to go through a fast fire round of questions.
Okay.
You want to go first?
I want you to go first because
I don't have any questions in front of me either.
Oh, well, then
just
we're
pick
just
one up.
Okay. All right, Ryan.
Yep.
Desert Island. If you could only eat one thing for the rest of your life, what is it?
Pizza.
Pizza, any kind?
Pizza.
Okay, just pizza.
Not vegetarian, but just pizza.
Okay. So if you had marinara pizza, like margarita or whatever, that's it.
I can eat eggs every day. It drives my wife nuts, but pizza.
Pizza. Okay. What's on your nightstand?
Oh, Standing on the Edge by Joan Halifax. Amazing book that talks about altruism and, edge states.
Cool.
I would encourage anybody that really kind of is in the mental health practitioner realm, whether you're peer support, really understand and read the book because it's powerful.
Okay.
Yeah.
Favorite piece of clothing?
Oh, shoes. My Vessies.
Okay, the one.
I'm gonna plug the Vessies because they're amazing Canadian shoe.
Okay.
Waterproof, really good.
Okay.
Yeah.
If you could go back to any point in your life,
yeah.
So either start it from scratch or any other point, where would you go and start it over?
And start over?
Yeah.
Nowhere.
Nowhere?
Nowhere.
You just stay where you are?
Yeah, because everything I did in my past led to this moment now.
Okay. And last one, what is something about you that nobody would know unless they really got to know you?
I have more than one tattoo.
You have more than one tattoo?
Yeah.
Interesting. How many do you have?
3.
You have 3?
Going for another one.
Are you?
Yeah.
I didn't know that.
Yeah.
Well, how?
I can't get a motorcycle according to my wife, so I get a tattoo.
What are they? Or is that a secret?
Well, that's for future podcasts.
That's for future podcasts. Okay, I know what my next rapid fire question is for you.
Great. I really don't have any good ones. I mean, coffee, black, cream.
2 creams, maybe more. I love a lot of cream.
Sorry to hear that.
I stopped with sugar in my coffee a couple years ago.
Okay, sandals with socks or no socks?
No socks.
What?
God.
Really?
Yes.
Come on.
And maybe no sandals. Throw some sneakers on.
Bare feet.
Bare feet better than sandals.
You could buy any car, any vehicle in the world. Any vehicle. What would it be?
That is such an interesting question. So I'm heavily committed to Mercedes-Benz. And there are a few really, really nice Mercedes-Benz. So probably something in the C family, probably sporty, and has to have the AMG engine.
Oh, fair enough.
Yeah.
If you could go to any place in the world to retire permanently, you can't move from it. Can't move. You have to stay there for the rest of your life. Where would it be?
Can I bring people with me?
If you want to go by yourself, you go nuts.
Okay, well, I mean, if I could have my loved ones around me, then I would go to the south of France. Like I'd go to Avignon, somewhere around there.
What about by yourself?
Well, I'd stay here.
Really?
My loved ones are here.
Oh.
Because
anywhere in the world.
Well, anywhere in the world.
And you choose Calgary, Alberta, Canada.
Because of my loved ones. Because what the hell do I want to be in Tahiti by myself?
Oh, fair enough.
Yeah. So I would go. I mean, that's the home is where the heart is kind of thing, right?
Perfect.
Yeah.
All right, listeners. Well, that's our fast fire round, and hold on to your seats because I think next week's guest is going to be pretty amazing.
Yeah.
We'll just tease it with he works in Calgary or close to Calgary.
He works close to Calgary. Yeah.
He is in the fire service.
Yeah.
He is a ambassador for our BOS program and just an all-around nice guy. So
yeah, he's one of the best people that I've ever met for sure.
We're gonna hold on to this for now, but thank you for listening and take care.
Okay, thanks. See you next time.